Many people know about hot flashes, but there are other menopause symptoms, like vaginal dryness, that take people by surprise. Estrace vaginal cream, also known as Estradiol vaginal cream, is one treatment option that may help. Here's what you need to know if you've been prescribed this medication. During perimenopause, estrogen levels decline. Estrace vaginal cream works by adding more estrogen to your body to relieve vaginal dryness, itching, and burning. But it may not provide relief for body-wide symptoms like hot flashes or night sweats. Estrace is a cream that you insert inside the vagina with a provided applicator tool. The applicator is reusable, and you should wash it with mild soap and warm, not hot, water after each use. You typically start at a higher dose that may be reduced as symptoms improve. Higher doses are usually applied daily, but as that decreases, you may only need to apply 1 to 3 times a week. Using this medication might increase your risk for vaginal yeast infections. To prevent infections, choose cotton underwear and avoid wearing tight-fitting pants or underwear. Side effects may include vaginal irritation, breast pain, nausea and vomiting, stomach cramps and bloating, headache, dizziness, nervousness, and mood changes. Don't be afraid to ask your pharmacist or prescriber about affordability. These days, there are many low-cost ways to get your medication.